Hi there, I'm your host Clive Serkin, and welcome to the Unstuck podcast, where we're on a journey to help you get control of your work environment, get yourself unstuck, and perform to your full potential. All right, so today we have a pretty special guest, a new friend, although I think I've known you for about 3 years now. But anyway, a really interesting story. The podcast is about Unstuck, and if there isn't a poster story for Unstuck, it's this one. My guest, Daniel Carcillo, came up from Ontario, King City, Ontario. We'll talk about that in a while. Made his way to the NHL, played I think it was about 5 teams, 2 Stanley Cups, and then a crash. Pretty deep crash, and we'll talk about that. And ultimately, an incredible turnaround story, and that's when I met Daniel. So, Daniel, first of all, welcome. It's amazing to have you on.
Yeah, thanks for having me, man, and thank you for. I love the premise of your podcast.
You
Talking about dark times and how people, endure and get out of those.
Well, that's the reality. It's whether it's personal or business. I think it's naive to think that it's all going to be plain sailing and great, and you're going to hit walls. In your case, it was a pretty big one. But
Yeah,
people hit walls, and it's less about the walls you hit and how you respond to them. And what blew me away more than anything else is how you responded it to. But let's talk. Let's break it up in 3. Let's talk NHL first, then we'll talk about the crash, and then we're going to talk about Wesana. So King City. I lived 4 years in Toronto. Never heard of King City. It was like 10,000 people. Talk about the journey from King City, how you got into hockey, the Canadian. But it's an unbelievable grind to make it. All the way to the NHL. Not only that, sustain in a couple of Stanley Cups, which tiny percentage of players do. So talk about the journey and what it was like.
yeah. So we grew up in a small farming town in King City, Ontario, about 7,500 people back then, and now it's around 30,000. But still a relatively pretty small town, and a lot of in Canada, the community evolves around the rink, and that was no different. So as soon as I could walk, me and my 2 brothers were in skates and just playing hockey against other kids that we were growing up with, and I was really drawn to the sport early on because if anybody's ever watched hockey, it's a really wonderful anger management tool, if you will.
Yeah.
And so from a young age, I really was drawn to not only the fact that you could, play by a different set of rules than real life, but you can also within those rules play with a team towards one common goal, which is to be able to achieve what you want to do, which is win the game and then ultimately win a championship. You have to come together, and there's different roles, there's different responsibilities within that team dynamic, and I just was immediately drawn to it from a very young age.
And in those days, you get on the ice and you're thinking, one day I'm in the NHL. Like, was that the desk? Like, was it clear in your mind that like we're going to the NHL no matter what?
No, I grew up in an Italian household where my parents instilled a very stringent work ethic based off of what we seen and what the chores we had to do around the house, etc. So anything I did to the best of my ability. I think I realized around 14 years old, I made a pretty conscious decision that it wasn't necessarily growing up thinking, oh, I'm going to be an NHL player and that's it, or else my life's a failure. But I realized at 14, I was like, all right, I mean, I could use this skill set to get out of this small town and make something, pretty substantial of myself.
But to make it to any level on any sport, particularly in this thing, it's an unbelievable commitment of time and hard yards. But was there ever a time where you went like, this is too hard?
Yeah, I don't think that gets talked about often enough. Where hockey's a unique avenue of development. Where, like I said, I mean, I moved away at 15 and a half, 16 years old, to a town that was 4 hours away to play against 21-year-olds, 16 to 21-year-olds. And that's where NHL scouts are living and breathing and looking at the next evolution of players coming up that can make up an NHL roster. And too often, it's not talked about the sacrifices that professional athletes make from a time perspective standpoint. From, I didn't realize it then, but I pretty much gave up my whole youth. And I didn't get to go to the high school parties, and we were usually riding on buses. And there's a lot of things that happened along the way that were necessary, I think, for my acceleration and for my evolution into somebody that was essentially, nicknamed Car Bomb in the NHL, and I fought 164 times. And there was a point where, the first year that I moved away, it was my draft year, and it was pretty challenging. There's a cult like mentality in the NHL, very similar to the military, where you get hazed, and 12 of us had a really difficult time throughout that year. So it was the best year of my life, and it was some of the worst times of my life because of this particular hazing. But I think it was necessary in my evolution. If I look back on it now and I've reconciled myself with that trauma and with the abusers, I don't think I would have had such a long career and done what I did. And just I wouldn't have had the same fuel to be able to execute 164 fights and be able to protect my teammates against essentially getting taken advantage of on the ice, which was a very important part of my skill set.
So I mean, I don't want to read into it, but it sounds like a part of what happened on the ice was a response to what happened on off the ice, in the sense of like the anger, because to have that many to play the role you played and have that many fights, and we'll talk about the physical impact, but the psychological impact, was it therapeutic? Was it part of the process?
Yeah, I definitely used the different rule set on the ice. The fact that there's no other league in the world other than now the bare knuckle fighting league, where you can drop your gloves and hit somebody with no wrapping on your hand and bare knuckles and inflict damage if they don't play within the parameters of the game. And there's rules of the game in hockey that people see and can read into, and then there's rules of the underground, right, where there's some unspoken rules that you just don't do. And if that's crossed, for example, one of the main rules is, if you know that a guy doesn't fight, and there's a superstar like Patrick Kane or Jonathan Taves, and somebody takes a run at them, well, then you'll have to answer to somebody like me. And in my particular skill set, I, because of that off ice trauma, whatever have you, happened, if you took advantage of somebody, I didn't even know what I was going to do to you. So that unpredictability served me in serving this role on a bunch of different teams, and really ensures that these skill guys can do what they need to do to ultimately win the game and have freedom to operate. So in a sense, I look back on my career now from a very young age to how I evolved to my last 5 years in the league, when I started to like get more involved in like meditation and how that kind of, changed the conscious decisions that I was then making on the ice. But, everything was absolutely necessary for me to become, the person I am today.
And it's like, it's interesting. And I knew this because when I was in Toronto, I used to go to a coffee shop where Ty Domi used to go. And I used to sometimes, when I would go to the games, I had a friend who had tickets right behind the box. So I got a sense of Ty, and then when I got to know you, it was another data point. Whereas the perception is the guy who plays your role is this brawny, knucklehead with no nuance and intellectual. And when people are going to pick this up in this conversation, but when I first met you, it was incredibly nuanced, deep, sensitive guy. So it's like the stereotype and the reality is pretty different.
Yeah.
And
Yeah.
I'm sure you've
Yeah.
heard this before, right?
Yeah. I mean, I think I've always had comments, right, where like I'm definitely an empath in a way that I am extremely sensitive person. I feel everything more so than maybe the normal person, whatever that statement means. But I definitely have higher emotional reactions to seeing people taken advantage of, and um, I uh, I like to think that I kind of like that, right? Where people see this first layer of you, and it's not the real layer because I mean you're essentially playing a persona, just like Ty was, right?
Right.
You're playing this persona that, and it's a character, and then when you get off the ice, you're your true self, and my true self is most definitely calm, collective, almost like a warrior in a garden, if you will, right?
Yep.
Rather than and just being, you always, like Bruce Lee said, you always got to be worried about the calmest person in the room, not the loudest.
Yep. That's incredible insight. So all right. So we're five teams in the NHL. You grind, and this is after a long grind getting your way into the majors. Coyotes, Flyers, Blackhawks, Kings, Rangers. I might have left one out. I know you were drafted by Pittsburgh, but so and then you make it to like the 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 big time, which is two Stanley Cups,
Yeah.
which I had the joy of watching. But talk about it, the feeling. Like this is like, I mean, unbelievable hard yards to get to this point, and then you reach the sort of pinnacle, if you will. Like, help us understand what it feels like.
Oh, yeah. It's something else. I broke into the league, so I graduated high school. I got drafted at 18, graduated high school, and then turned pro. 18 and a half, 19, right after my senior year, grade 12 here in Canada. And then the journey really started, right? I played a year and a half in the minors, and that's a lot of riding buses for a lot of hours, playing, three games back to back to back, and not necessarily in the same city, and just hard hockey back in the day. Because I think people that see the sport now, it's more focused on skill and actually scoring goals, which is great. But ultimately, when you get to that final prize, like the NHL playoffs right now, when you play 7 games against a team, you have to take your opponent's will to play away. So that means that you have to lean on people with physicality, and there's no out of bounds in hockey, and that will never change. No matter how skilled the regular season gets, the playoffs always intensifies. And if you're not, taking that opponent's will to play away, they have confidence to continue to touch the puck, and eventually they will beat you. So it's always a test of will. And from that sense, when I broke into the league, I in the minors especially, I scored 30 goals a year in the OHL. I got drafted as kind of like a goal scorer, skater, hitter, fought 4 times, and then that first year I started fighting. I put on some weight and I started beating guys up, and it was just something else you could put on your resume. And I looked at it as very much job like, and then that helped me break into the league faster than say some of my colleagues, right? Because I wasn't in the upper echelon. I wasn't a Patrick Kane type of goal scorer. And then you kind of get pigeonholed, but that was okay. I played, my first 3 years for Wayne Gretzky in Arizona. He loved me because I was an old school type of player. And then I ended up playing 2.5 years in Philly. But those first 5 years, I blew up my ACL, I blew up my PCL, I had labrum surgery on my left shoulder. Like there were a lot of injuries because I was living a pretty fast life on and off the ice. I was, if you look at it now, I was definitely abusing alcohol, opiates, these types of things, and not really caring about my health or longevity, right, in the league. And then, luckily I made some mistakes where it put me in the substance abuse program. And then, it forced me to ask for help, and it forced me to look at my career at 25, where I only played probably 4 playoff games up at that point. And then once I asked for help, and I started getting introduced to different types of recovery tools like meditation, float tanks, hyperbaric chamber, these holistic measurements of helping myself get down after games rather than using Ambien and beer and things of this nature, right? So, in my last 5 years in the league, from 25 to 30, I went to four Stanley Cup finals with three different teams. I lost twice and won twice. I became a much better teammate, family member, friend, and I got to understand myself a lot deeper, And but all the while, I did sustain, seven concussions across this lifetime and a lot of subconcussive hits. And unfortunately, when I left the game, it's the real fight started, if you will.
Well, let's talk. Part of that journey, and I know Steve was a big part of your life, and he helped you through that part of the journey. And then,
Hmm.
unfortunately, you lost him. But so, talk about because you had sort of those issues, but then you had the physical issues, and then
Hmm.
you leave the league, and the physical issues come home to roost, and
Yeah.
and in a major kind of way. I mean, talk about that.
Yeah. So, and thank you for mentioning Steve. I mean, Steve Montador was an amazing friend. And I really don't know if I'd be here, without him because on a couple different levels. So when I went to Chicago, I made a decision to get sober at 25. He was there. He was leading a sober and happy life, and just showed me these different tools that I learned in rehab, and showed me how to go deeper. And we became extremely close over the next 6 years. And so from that standpoint, he was huge for me, and then and just like helping me understand myself, being confident in who I was as a person, away from the facade of substances. And then he was absolutely instrumental because of how bad he was suffering when he retired after 19 diagnosed concussions in the league. I started to see him leave the game, and then this symptomology kind of exasperate or accelerate, so things like mild dementia, right? Like, so at 34 years old, dealing with light sensitivity, slurred speech, headache, head pressure, insomnia, impulse control issues, anxiety, depression, suicidal ideation. So some pretty serious symptoms. But if I didn't see him going through that, I would have never been able to make the decision for myself to step away in my last year in the league. And, unfortunately, it wasn't medical professionals that helped me do that. It was me seeing these things in myself. And then also, so I'll play out my last year in the NHL, 2014-15 season. My son was born November 14th, or November 24th, 2014. Then Steve passed away February. And then I had my seventh diagnosed concussion in March. And then I won my second Stanley Cup with the Hawks. And then I started to just do things that weren't normal. I didn't want anything to do with my son, and all I've ever wanted to be was like a really good dad and be connected to my kids in a really intimate way. And then I didn't want to go to the banner raising. I didn't participate in any of the concerts or any of the parties or anything like that. I just wanted to isolate. And pretty rapidly, things started to go downhill after I made the decision then to step away. And yeah, I mean, I just honor Steve and our friendship, and what I mean, ultimately what his death helped me kind of realize. It just really helped me. It saved my life, in a very strange way. I know that's a very strange way to put it, but it
It makes
definitely it definitely did.
As tragic as it is, it makes total sense, and it's so
Yeah.
much. I mean, we could talk about his story, but I mean, as I understand it, his girlfriend gave birth to his kid right after he passed away, which is in and of itself just unbelievably sad.
Yeah, it's I mean, it's sad, but it's also, I mean,
Something
Native
good.
American culture. Yeah, Native American culture, like, so I mean, I want to honor him for sure, and I want to tell this story. Chantel had Morrison, their son, really difficult birth within 2 weeks of Steve's death. And in Native American culture, they believe that death and birth are intertwined. And if there's death, like when my grandparents, my grandfather specifically died, right around the time that Steve passed and my son was born. And so they believe that, my grandfather's in my boy, right? And that Steve's, intimately there. And Chantel is very spiritual. And she thinks that, that was Steve playing with Morrison, right? Like before life, like before he came out of the womb. So I mean, yeah, I completely agree. I completely believe in all of that for
Right,
sure.
without a doubt. But so I mean, you got to a point where you were contemplating suicide.
Yeah, yeah. I retired in 2015, and then rapidly went downhill. I tried pharmaceuticals that doctors were prescribing me that were never asking me about my TBI history, and they exasperated different symptoms like head pressure, memory issues, appetite loss. And my life's journey now, I've spent the last 8 years, right, since 2015, kind of researching different treatments, but for the first 5 years, it was dedicated to what essentially the white coats told me to do, right? These medically accepted ways to diagnose which parts of the brain are shut down due to trauma. In my case, physical trauma, emotional trauma as well, and then you can wake them back up by essentially going to these like stroke rehabilitation, concussion like clinics, right? Well, they'll do neurofeedback, they'll do sensitive diagnostics, and but one thing they won't do is recommend like supplementation and these other natural forms if it's going to keep you out of the clinic, right? Not a lot of this stuff is reimbursable by insurance, and it cost me an arm and a leg. So I got to a point 3 years in where I was probably 400,000 in the hole and not getting any better. So then I started to like move away from the medically accepted and getting into like float tanks, hyperbaric chamber, moxa acupuncture. Moxibustion is a natural Chinese anti-inflammatory. Um, cranial sacral, depressurizing the head, and just focusing diet, sleep, different regimens, and testing again for 2 years, and then nothing, right? Like not much movement there either. So 5 years in, started to make plans to take my own life. As a TBI survivor, the number one cause of death is suicide. And I believe it's because number one, there's a lack of education awareness about these symptoms. And then there's also a lack of education awareness of how you can get better. So then people lose hope, and then it's I don't view suicide as a selfish act. I was viewing it in the light of an unselfish act where I now have three kids, right? 7, 4, and 3. And at that time I had three, and I'm like, man, I do not want my kids to look at me engaging in life thinking that this is normal. This is the way I need to live. And I wasn't I wasn't partaking in my family's evolution at all, right? I was isolated in my own victim type of mentality and these different treatments. So luckily, it just so happened that a former teammate reached out and said, "Hey, man, I could tell you're suffering, and you should come and try this alternative treatment. I think it could help you."
And I want to talk about that, but before we talk about it, the thing that's most profoundly impacted me when you told me your story the first time we met was like, here you're married to Ella, you got three kids, like you got everything to live for.
Hmm.
And the way you just articulated it, which is, because people are like when a kid in our neighborhood took his life recently, and anytime that happens, I always sit down with my kids, and they go, "Oh, here we go again," and I'm like, "Do you understand that there's nothing we can't solve together? Like, don't ever feel like that's the only option." And the
Yeah.
way you articulated, which it's like it was not a selfish act. People don't understand that, and I think it's really profoundly sort of impacted me when you talked about it that way.
Yeah. Um, I'm just grateful that, like, I was always advocating, and I always will, right, for things that work for me and things that people can try and things that don't work for me because it might work for you. And I was really just at a point where I was just completely honest and engulfed in anger, frustration, and sadness. not only because of what the position I was put in, where, and then I was finding out that the NHL knew about these types of things and could have helped, but didn't. And I just, I was viewing it from the context or the lens of, you know, I'm a shell of myself. I'm nothing to anybody around me. And I'm sure if you ask my wife or you ask my, now you ask my kids, then they were young, it would be different, but I just didn't want to be that type of example to my kids. And so that's why I was contemplating it. And I believe that everything happens for a reason, just like how I believe now I can reconcile with that, sexual, physical, emotional abuse back in when I was, 17, playing hockey and kind of formed me into car bomb, and then led me to the addiction of the trauma. Now I know that I was using substances to not have to face that.
Yep.
And then I faced it a little bit at 25 and then got better and then kind of had to face it again at 30 and 30 to 34, 35. I had to wake up to the fact that a new, like, these types of treatments, like doing your own research, right? I'm a huge advocate for, I read an article, I don't take that information at face value. And even before I read an article now, I go and research who wrote it and who they're employed by and then why they're writing it,
Yep.
right? So, and then I think that's really important, to understand where your information is coming from, and you take all this information and you make the best educated decision that you can. And at that point, man, I was at the end of my road, or at least it felt that way. And luckily, there's always, like, if people are listening to this, right, and you think you're at the end of your road, I tell you you're not. I always had this little tick in the back of my head, you're going to get better. You're here for a reason. You are going to get better, and you're going to find something that works, and then you're going to find something that you're going to be able to advocate for millions and millions of other TBI survivors.
So talk, and that's the most important. Like for me, like that's the most important thing. So talk about that thing. How did it happen?
Yeah, so actually almost canceled the night before, and I don't know if I'd be here if I did that, because there's this fear, right? Like, we all have this sense of who we are, and as a victim, or I should say, as a sufferer of anything, if you're suffering from anything, when you suffer for that amount of time, you almost get comfortable with people around you treating you like a victim, right? Like, oh, no, no, like, trust me, he's not an asshole. He's sick, right? Um, and so from that sense, like, there was a big part of my ego that I think didn't want to let go, but I somehow willed myself to get on this plane, take this invitation to Denver, Colorado. And I thought I was going there to learn about functional mushrooms, lion's mane, reishi, cordyceps, chaga, these things that you can get at Whole Foods, CBD. It's a patented natural anti-inflammatory that it could help. I was like, all right, great. Like, and I trusted this guy who invited me. And when I got there, it was all of that plus more. So they both just kind of confronted me, my former teammate and this PhD biochemist, and said, hey man, I know that you're suffering, right? And I was like, yeah, I mean, absolutely. Like, I'm in a really bad place, and I need help. And they just said, we want to do something for you. I said, okay, well, what is it? And they said, we want to give you psilocybin mushrooms. We want to give you, essentially magic mushrooms. And we think that this can help bring your brain back online. And I said, oh, okay. So I did some quick research, that day. I was needling around because I'd noticed my teammate was posting about this stuff before. And I said, I was just like, kind of threw my arms up. I'm like, all right, man, if you guys think this could help, let's do it. I have nothing else to lose. So we did it, and it was it was, I would say, like, 2 hours, 2.5 hours of the most, difficult, some of the most difficult images that I've or ceremony that I've ever have to been through, right? So psilocybin, magic mushrooms done at a high dose where you can't run away from it, right? So essentially think of like if you take a low dose, go to a concert, it's really enjoyable, it's amazing. Well, think about taking like 5.5 grams where you can face your trauma. So essentially it exasperates what's at the forefront of your mind, and it shows you essentially it was going to show me why I was suicidal. And these guys prepped me for it. And I was like, hey, let's
So,
go, you know?
so just I don't want to cut in because this is so important, but the one thing is like people talk about set and setting. Wasn't like a bunch of guys popping some shrooms and going to a dead concert.
No, no. You know what's funny about that, Clive? I was like, all right, like I'm gonna do some mushrooms, right? I've done them recreationally. Like, where's the beer? Let me get a pack of smokes, and let's do it. You know. And these guys were like, no, 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 no. That's not this, right? This is completely different. And I said, okay. And after they explained it to me, and showed me some of the science, right, prepared me. But essentially, in these high dose ceremonies of psychedelics, preparation, um, setting, and dosage are extremely, and then integration are all extremely important. So that means your set intention. Why are you doing this medicine, right? And if you're contemplating traveling to Denver, an unregulated country, to do psilocybin mushrooms in a high dose form to be shown the trauma that you need to see to move past the trauma, um, you know, you usually have a set reason why, right? And my reason was quite simply, I need to recover my brain health. And then setting, I was in a beautiful farm on a beautiful farm, surrounded by cannabis plants and people that were experienced in doing these types of ceremonies hundreds of times with hundreds of people, right? So that's really important. And then dosage, and responsible medicine, obviously. And this guy was a PhD biochemist, and so I trusted my teammate and completely, went into it. And then integration, right? So basically, I could call these people because they're experienced in understanding the imagery that this medicine showed me, right? So from that sense, it was 2.5 hours of basically, this medicine showing me that I was stuck in a loop. So even though I was on a beautiful farm, it was an unfamiliar place. And so I was caught in this loop where I found myself in my life, where I was stuck in this loop of anger, frustration, sadness. And I was lost. And I had no idea what I was going to do next because I'd essentially just exercised myself from the hockey community because of the anger, frustration of what happened to me and Steve. I just cut them off. I stopped. I had to. And so what was pretty amazing about this, and I'll just touch really briefly on what was happening in the ceremony. You always fast because with these high doses, it can bring on nausea, and you can dry heave this type of energy out or purge this energy out, right? And that happened with me. And I was outside, kind of, um, you know, like, why is this happening? And just getting this energy out,
Yeah,
right? And understanding it.
yeah,
And these guides, they would put their hands on me to help guide me through, and it felt so comforting when that was happening. And then I would go inside, I would kind of, shuffle around, try to figure out where I was, and I would do it again. And I did that like 40 times, 30 or 40 times, and then eventually, I started to, they brought me into another room, played some 432 hertz music, which is the frequency of nature, which really calmed me down. And then what happened was, my teammate, my former teammate, had really long hair, and he came to me in the presence of, and I used to be an altar boy, grew up Catholic, in the presence of God, and he said to me, he turned to me when we were on this couch with the music playing, and I was calming down and sort of surrendering to the medicine, which is key. For the medicine to kind of show you, I was really fighting it. He said, "This is why we want you here." And I'll never forget this. We want you on our team. And I said, "Me?" I said, "Why me? I'm such a loser. Why me?" And 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 they said, "You're not a loser. like we love you. And just that, I was just like overwhelmed with a sense of calmness. And I just said, okay. And with the hallucinations of thinking this was, the reincarnation of Jesus Christ, I just laid down, and for the next hour was transformed into a blissful state of relaxation and this meditation of being able to forgive and love myself and actually like myself.
And by the way, we're gonna do a whole other episode where we'll talk about psilocybin more broadly. And for those of you listening, like this is my suggestion to you is read the book How to Change Your Mind. Um, Personally, for
It's
me,
a great book. Yeah, Michael Pollan. It's a
Pollan's
great book.
book, it's a great primer. It's sort of the
Yeah.
layman's thing, and it's sort of after I met you, I read that book and I was like, okay, that sort of started my journey. So, and it will clarify some things. And this is like serious, serious stuff. But and the only reason I say that is because I want to talk about Wesana and what the conceit of Wesana is, but I don't want to short shrift the power of psilocybin and what it does. And I
Yeah.
it's
I mean, I could definitely, kind of close the loop, right?
but
Where it's this this medicine did for me in my brain spiritually, right? Which is one thing, and then in my brain, connected right and left brain hemispheres. So essentially woke up these brain hemispheres that all of the medically accepted white coats were telling me they could do in their clinic through neurofeedback and all these exercises within 4 hours. Woke up everything. And if you go to Beckley Pharmaceuticals website and you look at somebody on psilocybin, a placebo brain not on psilocybin, and somebody on psilocybin, you'll see all these brain connections, right and left brain. And so after I woke up the next day, what happened was like uh, I felt the way I should. That's the only way that I could describe it immediately. And then, as the days went on, my light sensitivity fell off. Didn't need my sun blockers on the third day on the farm. Slurred speech was totally gone the first day. My need for isolation and depression wasn't there. All I wanted to do was get back and hug my kids. A bunch of these things started to happen pretty rapidly, and then I knew that nothing gets fixed in 5 hours. So I made this regimen of low dose therapy so that I can continue this this type of initiation of, now I know, right, the 5-HT2A receptor, which is serotonin. And then I did this for like the next 6 months, one ceremony, and then I retested my brain. So I tested my brain and blood before I went, and then I tested it after 6 months, and for the first time in 5.5 years, I had no abnormalities. My
and I
blood work
saw
was
I saw those
clear.
scans. I don't know
Yeah.
if you told this to me because after I met you, then and it's coincidentally my son who's a pre med at the exact same time I met you, he started getting into psilocybin, and his intention is to be a neurosurgeon. But and he sent me some stuff. But I think it was you who said this to me, which is when you're in a sort of traumatic cycle, every time you hit trauma, the same pathways open up and you just go round and round and round. And that sort of creates
Yeah.
a sense of hopelessness. And one of the consequential outcomes of psilocybin is it opens up new pathways. So when you encounter the trauma, there are different pathways to go through to respond to it. And you don't
Yeah.
get the sense of it. Is that, did I articulate it correctly?
Yeah, you did. Absolutely. So in Paulin's book, the best way to describe it that I've heard him describe it is, before you do a psilocybin ceremony, right? Anger, frustration, sadness. And there's a saying in neuroscience, positive or negative, if you use it, you won't lose it, right? So that being said, if you're stuck in these ruts, so think about waking up every day. People are extremely predictive, right? We're repetitive creatures. And if we live our life based off of the generational trauma or the trauma that we received, we're pretty well indicated to react to life a very predictive way. So you create these ruts that you go down a ski hill every day. There's only 5 or 6, and you live your life in a very predictable way. Psilocybin, psychedelics, high dose therapy can put snow on the hill, new snow, fresh powder. And you'll wake up the next day and you'll be able to choose whatever path you want to go down. And if you have this profound experience in the experience, you can wake up with a more positive mindset. With the right coach, you can then lead, like you faced the trauma in the ceremony. You have this newfound energy for life. And if you move positively with these positive thoughts down these new slopes and start carving out these positive reinforcing pathways, just like the negative reinforcement, you can stay in them. You can stay in them. And that's the best analogy. It's essentially just shakes up the snow globe. And what I knew just from my research, right? I'm not a doctor, even though this is so funny, man. You sent me this link. Clive sent me this link with says Dr. Carcillo. We were dying. And I'm definitely not a doctor, but I know enough about the brain. And from my last 8 years of research, I also know nothing gets fixed in 5 hours. So the thinking, right, the repetitive thinking, if you use it, you don't lose it, can help. But what can help even more is like a subperceptual dose, right? Of psilocybin to keep you in these pathways, to keep hitting the same serotonin receptor. And then I added in CBD, which is a patented neuro anti-inflammatory, patented by the US government against neuronal death, because I knew that, associated with TBI, there's a lot of neuronal death and even aging, right? And then, like I said, I just created this regimen, specific milligram amounts, stayed on it for 6 months, retested my brain with science. Knew then, I was like, wow, this could be the first FDA approved pharmaceutical for traumatic brain injury survivors that could really help people. And in drug development, I started to, think about patenting this regimen that I invented, which there's nothing wrong with that. And then, I met certain people like Chad and Aristotle and yourself, and just people that came into my life that could help me with business and infrastructure and capital raising. And then we ended up founding Wesana, call it a year and a half after my recovery. And, now we've, fast forward to today, we've communicated with the FDA in a pre-IND meeting, which is an investigational new drug application. It's kind of the first step to getting them to understand the science behind what helped me get better, and frankly, what's helped millions of people worldwide. Because it's not just me. This isn't an and one. Get better, and we're well on our way to now clinical trials and structuring this in a very poignant manner to essentially have like an at-home presentation of a new SSRI-like drug, right? That does not have a large abuse liability and isn't associated with many side effects.
But let's just back up, because you had, I mean, this incredibly profound sort of experience, and that inspired you to create Wesana, to launch Wesana Health, the company. And full disclosure, after I met Daniel, I invested in Wesana Health. And so you've launched Wesana Health. It's a publicly traded company. Talk about, what is the vision of Wesana? Obviously, you want more people to experience what you experienced. There are other players out there in the space. The first thing I did after I met you, I started doing my homework, and it's like, and I understood what happened, and how Larry unfortunately collided with the Nixon administration, and all this incredible research got put on hold. but we're at a point now where a number of the leading sort of institutes, Johns Hopkins, because everyone knows them, but a number of like highly reputable institutions are doing deep research in the space, and it's credible research. So you create Wesana. What's the conceit of Wesana? What are you trying to do?
Yeah. So I guess I should preface like the first thing that I did after backing an anecdotal story, which is cool with science, was to then research and reach out to some of these organizations that are doing this work. And I thought, okay, John Hopkins just did a study on end of life cancer patients treating their anxiety, their end of life anxiety associated with a terminal diagnosis, and they ranked it in one of the top 5 experiences of their life, and it essentially, you know, helped cure end of life anxiety, which is obviously the biggest unknown that we all have. So if it could do that for cancer patients that know they're going to die, what could this do for other people? And this is John Hopkins, right? So then NYU came online, Imperial College of London, like major institutions researching this in an IIT form. And I thought, okay, that's great. Academia's, behind it. How do you create a drug? Like, how do I, for my community, because this has always been my mission to advocate for different treatments that may be able to work. How do you create it, essentially go through the FDA? And I'm interested, this goes back to like my predisposed life where I was, this is a new game, if you will, and new rules. So I had to, number one, find a team that could develop a drug that's done it before, several times over, and then put my story of how I've used this medicine, because different medicines are different, into a clinical setting that the FDA accepts. So that means animal models of depression, where they test this hypothesis in animals first. And if it works well there in these FDA validated depression models, then you can move into human clinical trials, right? And you obviously need people that know what they're doing to do that. So we did that. And then, once we found the signal there, then it was kind of full steam ahead to where, we're bringing forward a novel depression protocol that can help people, physical, emotional trauma, heal from their trauma. And one of the things that is different about this is it's going back to what big pharma was founded on, which is extracting from plant and fungi and these natural compounds, and using them, on human beings in a clinical setting. Because I mean, we're, regardless of what anybody thinks, we're born out of this world, not into this world. So a lot of the things that we find in nature help us. There's a lot of things that could hurt, but that's why you go through the process to make sure that it's safe and efficacious for what you want to treat. And I just started to read and meet people and listen and use the skill set that I learned, thank gosh, in hockey, to apply it to now business and drug discovery. And we've since communicated with the FDA about our protocol, which is using high doses of psilocybin in a clinical setting with support. So you have the proper setting, dosage, preparation, integration, which I touched on earlier. And I believe that this will be the new standard of care moving forward in the next decade. And it's I often take a breath because I feel like this is what I've been prepped for my whole life. This is my life's mission. We sauna, if people are asking themselves, what does that even mean? Sauna means heal in Latin, and we heal together. And Conrad Lisko and came up with the name, and it was perfect because as a TBI community, a mental health community, we all try to heal together. So essentially, I'm just trying to support people on their mental health journey with something that I believe strongly, and millions of people and as you've seen, like diving into the research, right, believe that this could be the next real paradigm shift in treating a wide variety of mental health complications.
There's no doubt in my mind. And as we discussed, we'll do another episode where we'll talk about psilocybin and the established research out there and where it's headed in that. Because if you know, I would say everyone should be doing research into this space because it's going to be transformative. And I have a personal interest in this, which we'll discuss in the next one. This has been my longest episode for all the obvious reasons. I think everyone would agree. I one of the joys of where I'm at in my career is the opportunity to meet people, and because of Chad, I met Daniel, and it's been transformative. And I think people listening to this conversation will understand it. It takes a lot. It's incredibly generous to share the story you have about yourself in the way you do, with no filters. And I think it has a profound impact. And that's what inspired me to get involved in Wesana with you. So, my friend, Doctor.
Yeah, man. Well, let me, you've obviously said a lot of really nice things, and I appreciate, like I said at the beginning, the platform that you have. I was immediately drawn to you because of, just your energy, your kind nature, and, you're funny. You're really funny. And it's like, you don't take life too seriously. And often, in business, you can come across a lot of roadblocks, and it's no different. Like, I'll tell you right now, there's still, I don't suffer from any symptoms anymore. I'm definitely cured of that. What I'm not cured of, and what we'll never get cured of, is stress and roadblocks, and things still come up.
Life.
Yeah, life still happens. And luckily, I'm able to rely on people that can help me, help guide me through these situations. But, thank you for doing what you're doing and advocating for, different types of tools and different ways of thinking about life through this platform. So, yeah, man, it's really cool.
It's a huge deal. And that's why we will do episode 2. We will talk about more of the research. But in the meantime, whoever's listening, and if you're not intrigued by this, then I don't know what you're on. Go and get Pauline's book. Read that. There's some other stuff you could read, but start with that. It's an incredible read. Dr. Carcillo, or as I say, Carcillo, the Italian way. Absolute joy, my friend. Thanks so much for spending the time.
Yeah, man. Appreciate you, Clive. Thanks, buddy.
Pal.
This podcast was brought to you by Screen Dragon. We break down barriers, make work flow, and unlock talent. Visit ScreenDragon.com to see our software in action.